COVID cases are once again on the rise in India. The Indian government has confirmed the presence of JN1 subvariant of COVID-19 in the southern state of Kerala. The Union Health Ministry data on Monday revealed that India had recorded 260 new COVID infections within the previous 24 hours. Now, what more do we know about this subvariant? How contagious is it? How severe will the infection be? To discuss matters further, we're being joined by Dr. Rajeev Jayadevan, Co-Chairman, National IMA COVID Task Force and past President of the Indian Medical Association, and he's from Kochi. Welcome to WION, sir.
Thank you.
Mr. Jayadevan, let's start right off this JN1 subvariant. What do we know about it?
JN.1 is the most fast rising sublineage of the COVID virus around the globe. Data is coming in from nations that engage in what is called genome sequencing throughout the year. And we know that over the past few weeks, it has been designated the fastest rising variant worldwide. Now, I need to qualify that. When we say fastest rising variant, that does not necessarily translate into a greater number of cases. If you take 100 COVID patients around the world, all that means is a greater percentage is from JN.1 this week compared to previous week, and so on. So in developed nations, especially in the European countries, Canada, US, and so on, the number of COVID cases is in fact quite high. Many hospitals are overloaded, not all of them, but many hospitals are overloaded. Staff are coming down with COVID. They're taking time off. So the systems are being strained. So it's not just about the deaths of COVID that is straining these nations. So likewise, in my part of the world, that's Kerala, we have noticed an increase in the uptick or increase in the number of what we call upper respiratory symptoms, flu-like symptoms over the past couple of months, if you will. Unusually high. But as you know, in India, when patients go to a doctor, they don't really do a COVID test or influenza test. These things are expensive, cumbersome, and often deemed unnecessary by both the patient and the doctor. So for that reason, we do not have a large number of cases reported in India. And that's obvious when we look at the history of the pandemic in our country. But wherever testing was done for such patients, in months like August and September, there was hardly any COVID. I can confirm that. We've been tracking it even before it hit India. But come October, the numbers started creeping up. And in November, we saw about 7% of such patients were suffering from COVID and not from influenza. And it's among these 7%, perhaps, that they picked up one case of JN.1, and so many other sequences from the rest of India are pending their result as we speak. So it comes as no surprise that JN.1, which is a successful variant, if you will, that is infecting the rest of the planet, is also found in India, because India is well connected with the rest of the world by all sorts of travel modalities.
I just want to come in here quickly. You mentioned, before we move further, you mentioned that it was COVID and not influenza. For a lay person, I just want to really bring it down to a basic level. For a lay person, is there any way to decide or any way to infer whether this is influenza or whether it is COVID? Of course, your basic check is there, but in terms of symptoms, is there any difference?
It's a good question. These symptoms that I described are common to many viruses which commonly circulate in the country and in the rest of the world, influenza included. Influenza is not the common cold. Many people seem to confuse common cold with influenza. Common cold does not affect your health any number of times you get it. It does not. It does not kill people. Influenza can kill people. It can cause pneumonia, and it can cause even a cardiac problem, just like COVID can. So COVID, influenza, and common cold are completely different entities, even though the initial symptoms may be similar. I'll give you an example. Polio starts with a case of diarrhea, but we don't see polio as a case of diarrhea, do we? We see it as a paralyzing disease. The paralysis comes later. Likewise, COVID starts with what we describe as common cold symptoms, but later on, people who survive COVID go on, some of them get other sorts of complications. So back to your question, symptoms are similar, which is why testing is done, at least in a few samples of cases, so that we have an idea of what is going on in the community. If you don't test, we have no idea what these diseases are, what treatments should be done, how they should be triaged, and what preventive measures should be taken. For instance, COVID spreads through smoke-like aerosols, which is like if I'm talking, I'm producing aerosols that are circulating in my room. COVID spreads through that. Influenza spreads more by large droplets. If I cough, if I sneeze, on my hand, I shake hands with someone, the virus gets onto someone else. So there's a slight difference in how these viruses are transmitted as well.
So I also wanted to come to you now, how severe can the infection be? If we just come back to JN.1, the variant, the subvariant that we are seeing as of now, which is causing all these COVID cases to rise, at least the ones which are being reported. How severe will the infection be, or how severe will this bout of COVID be?
Yes. To understand the severity, let's look at it from the community standpoint. We run a consortium where we look at multiple angles, from research labs, from hospitals, from ICUs, from GPs, from patient, from actual patient. So from the actual clinic standpoint, let's say you take an average outpatient clinic, the doctor sits and sees patients. The common presentations are body ache, fatigue, sore throat, headache, fever, runny nose, blocked nose, sometimes even sinusitis. Lately, that's been a new development. Now, this is common for all of these viruses, so it's very difficult for the doctor or the patient to say it is due to this particular virus or bacteria, what have you. So that is the presentation we see out. I would say the vast majority belong to that genre. Now, they're not severe enough to get the patient hospitalized, but they do take a substantial toll on the economic productivity of the individual. The person needs to take leave. If it's a homemaker, she has to take leave. She has to, take it easy for a few days. This can disrupt things at home. So this is a disruptive process when a large number of people get infected at the same time. And as I explained, what is going on in developed nations. When your workforce is down, all sorts of issues can happen. Now, the serious cases, we are not seeing the pneumonias that were the hallmark of the Delta variant that ravaged the world in 2021, including our country. We're not seeing that. The direct COVID pneumonias are almost not there,
All right.
With very rare exceptions. But there are many people in our community who live on the border of good health, in the sense they have conditions that are manageable at home with some medications. When COVID lands on them, it destabilizes a few of these people, and they end up in the hospital and they seek treatment. And some of these tend to get ill and may require ICU care, and among them, some of them have bad outcomes. So on the whole, if you look at it on a community standpoint, from an individual standpoint, the risk is not huge. The immediate risk is not
All
huge.
right.
But from a hospital standpoint, it can overwhelm the hospital systems quickly if measures are not taken to stop the spread during a time of a surge. Remember, surges don't occur every day.
So if basic immunity is at a decent level, if you've been eating well, maintaining a decent diet, if body immunity level is good, then it will not be too severe. But if one is not keeping too well, then this kind of this infection or this the JN.1, it can cause somebody to be hospitalized as well. I also wanted to come to you just once again, if you could, maybe I'll request you to just do it in more simple English. If you could explain to us that when you say JN.1 is spreading fast, but that doesn't mean it is contagious. If you could just differentiate between that once again, a little more.
Okay. For our viewers, let's explain what JN.1 is. Now, since the inception of the pandemic, two major events occurred. One was the birth of Omicron, late 2021, and that changed everything. In 6 weeks, this variant covered the planet. We saw that. It arrived at our doorstep, all the way perhaps from South Africa. We do not know where it started, right? The second big event was the spotting of a all-new variant called BA.2.86. That was first seen in one of the Scandinavian countries in July of this year. That was so different from anything anyone had seen before in the COVID lineage. And that sparked a lot of interest. But the BA.2.86, in spite of all its changes, all its mutations, did not grow so fast and did not cause severe illness. So it sort of fizzled out in terms of the interest. It wasn't the monster that people thought it might turn out to be. And then was born JN.1. Now, JN.1 is actually BA.2.86.1.1. whenever the numbers of the sublineage increase, they give the alphabet a different name.
All right.
So that is why the name JN.1 came in. Now, because it's so different, the immunity from previous infection, previous vaccination, booster doses, or whatever combination thereof, will be of limited value in stopping infection. It could still be of value from getting you ill, but it might not stop you from getting infected with this particular variant, and that is the concern.
All right. All right. I understand. So basically, you need to ensure that your precautions are in place, your diet is in place, your immunity levels are at whatever best you can bring them up to, and and follow all the precautions that are being given out and all the advisories which are being given. I think that's the best defense against this. One more thing, sir, I wanted to ask you. Now, of course, we've spoken about how severe it can be, how infectious it can be. I also wanted to understand from you what would be the period of time that one takes to recover from it. Because we've usually seen it would take, for some people, it would last between 7 to 10 days, 2 weeks. But would this be similar to that? Would it be shorter and quicker to recover from it?
The recovery period is going to be no different.
All right.
But that being said, about 5% of individuals, it could range from 3 to 20%, depending on what studies you quote. About 5% of individuals who survive COVID or who had COVID and recover go on to get long-term symptoms. These tend to get ignored by the patient, by the family members, by the doctors, by the hospitals. But patients suffer, and this is called long COVID. Long COVID is a constellation of symptoms which include fatigue, which is tiredness. They're not able to breathe as well as they used to. They get short of breath as they walk or climb stairs. They can't remember things. They get confused at times. They get headache. They can't. So their appetite may be diminished, and they have all sorts of musculoskeletal issues as well, like joint pains, muscle pains, etc. With no specific cure, long COVID remains a challenge around the world. Many people are suffering, and there's a lot of disability happening with it. Because it is not such a dramatic outcome such as death, it tends to be ignored by many people. But getting COVID over and over will increase one's risk for developing this condition, which could affect our own good health, longevity, and productivity in some order. So there's also a vascular complication. COVID is also a blood vessel affecting virus. In a sense, it affects the endothelial surface or inner lining of blood vessels. So it's really not your common cold at all. So the World Health Organization says, you know what, the best strategy against COVID is not to get COVID. I think that statement underlines everything I said.
Perfectly, sir. All right. Thank you so much for joining in. And of course, the risks of long COVID, they loom large regardless of which subvariant or variant we're talking about, and precautions need to be at, one needs to give maximum importance to those, and of course try to build your body immunity at the best, in the best manner that you can. Thank you so much for joining in, sir. That was Dr. Rajeev Jayadevan sharing insights on the JN.1 subvariant, which is now, the reason behind the surging cases that we are seeing, and body immunity needs to be in a prime shape and form to be able to get past it, as always. Thank you so much for joining in, sir.
Thank you.